It's 2007. A mother and father lovingly welcomed their second-born daughter into their life. It's been a long day of labor and the baby is taken to the nursery while the mom gets some sleep. But a few short hours later, in the wee hours of the morning, a doctor wakes the mother with these dreaded words. "Something is wrong with your baby." The mother hastens to discover her newborn on a birthing table, the child turning blue while nurses and doctors run tests, worried that something is wrong with her lungs. The doctor's words would never be forgotten, words that break the mother's heart. Her lungs are healthy, but there's a problem with her heart. Immediately, mom and her newborn are helicoptered to the nearest children's hospital where physicians and nurses are standing by for further testing. The mother is whisked away, not knowing where her husband is or her baby. She's taken to a room, urged to take a seat, and told words that will forever change the course of her young family's life. Your baby has congenital heart disease. Let's take a step back. Of course, we all know what the heart does, but what does it mean to have something wrong with it? We need to start from the beginning of a child's life, the forming of the heart. As a fetus develops, a baby's heart begins as a single tube with 3 chambers. This tube then folds and twists, creating arteries and chambers, a miraculous process that usually happens in the first 28 days of pregnancy. These developments can seem deceptively simple, right? However, even the slightest wrong twist or fold can lead to congenital heart disease, more commonly referred to as CHD. Take a moment to consider how many people you know and how many times a heart is formed perfectly. It's absolutely amazing what a woman's body can do. However, the world isn't perfect. Sadly, there are several reasons why a heart may not be perfectly formed every time. Number 1, abuse to a woman's body. Number 2, medications. Some can cause heart defects as a side effect. Number 3, chance. The world is not perfect. That means a heart cannot always be formed perfectly every time. It's common to ask, how common is CHD? CHD is the most common birth defect in the world when compared to Down syndrome and cystic fibrosis. CHD affects 1 in every 100 children. This means 1% of babies born every year have CHD. In Canada alone, roughly 4,000 babies are born annually with CHD. What does it mean if your child is born with CHD? CHD is a broad term used when a child is born with a heart defect. There are approximately 40 different birth defects ranging from a heart murmur to underdeveloped parts of the heart. Not all CHD defects are diagnosed at birth. Some are found later in life. Not all birth defects are life-threatening. Sometimes a child just needs to be monitored throughout his or her life. Unfortunately, some defects require extensive open-heart surgery. Depending on the simplicity of the defect, some children only need to have a small corrective procedure known as a heart catheterization. This is when a long IV is fed through a vital vein in either the leg or arm, depending on the location of the heart needing repair. And then wires are fed to the heart to repair the damage. Multiple heart caths and/or surgeries are required throughout the child's life, depending on the severity of the diagnosis. Thanks to technological advancements, the survival rate for CHD has risen from 70% to 90% over the course of 30 years, with patients living into adulthood, with rates ever climbing. Let's pause and return to the story of our young mother. Sitting in a consult room, she is alone except for a doctor and nurse. She's told her newborn girl has transposition of the great arteries, which means her pulmonary artery and aorta are switched in location. She's then told she needs to undergo open heart surgery to switch them back. Your daughter also has a ventricular septal defect, a hole in between her left and right ventricle, and we need to patch that as well. Lost in a daze, the mother finds herself signing papers agreeing to her daughter to have a heart cath. This will open her patent ductus, a little tube connecting her aorta and pulmonary artery that all babies are born with so that the blood bypasses the lung in utero. Having no idea if her baby will be okay and unable to locate her husband, she waits the agonizing hours in solitude. Why do we need to learn about CHD? Let's ask what might seem like an obvious question. Have you heard of childhood cancer? Of course you have. Cancer affects 1 in every 880 children. While that is an uncomfortably high number, there are more children that suffer with CHD than with cancer. Cancer research and cancer patients receive enormous amounts of funding for research and for hospital bills. But sadly, congenital heart disease patients do not typically receive any financial help or assistance. Their cases are simply not considered severe enough. Not only is cancer better supported than CHD, Down syndrome, autism, and cystic fibrosis receive more aid and support from government, schools, and the general public. Another answer to the question is that hospitals need more doctors to help relieve the load of the cardiologists who already have too many patients or are getting too old to work. Pediatric cardiologists are trained to care for abnormal hearts. Adult cardiologists, on the other hand, are not trained in navigating abnormal anatomy. They can detect murmurs and many heart issues in older patients, but when it comes to the out-of-the-box thinking required for CHD patients, they are lacking the training and skills. There is a real struggle with a lack of doctors, and more patients are not seeing a cardiologist when the need is present. This ultimately leads to undiagnosed complications in young CHD adults, which can become life-threatening. My last answer to the question is like most people. It's quite possible you've never heard of CHD. This can prove challenging because though the survival rates continue to climb as population growth explodes, more and more children are diagnosed annually with CHD. This means the birth rates will never go down. Here's a breakdown to help you. In a sampling of 200,000 children, 2,000 of those kids can have CHD. If all 200,000 children eventually get married, and if each one of them have one child, there would be 100,000 more children. Of that number, 1% or 1,000 kids will have CHD. However, there's a 3% chance that those 200,000 children with CHD also have a child with CHD. This means that out of the 100,000 children born from the 200,000, there will be 1,000 to 3,000 children born with CHD. If those 100,000 children each have one child, there will be 50,000 more children. And if we continue the math, the percentage of having a child is 1% to 6%, or 500 to 3,000 children with CHD. And if you think on a larger scale, if every person with CHD lived till they were 80 or 90, there could be millions of people all over the world with CHD. All these points, lack of doctors, lack of world knowledge, and lack of empathy compared to other diseases is why CHD patients struggle in the world. They can get the help they need because the world doesn't understand how big the scale of CHD is and how much it really affects your overall mental and physical state. Before I end this video, I want to share why I chose CHD as my passion project. Because CHD is the most common birth defect in the world, people treat it as not a big deal. They think that it's not that hard to live with. I want to normalize CHD as a condition that, even though is very common, the struggles that millions of people face are overlooked because of the statistics. The father is finally able to make it to the hospital where he is told the terrifying news. After a week in the hospital, the exhausted parents are finally able to bring their baby girl home for a week to prepare for the surgery ahead. The surgeons worked tirelessly and repaired her ventricular septal defect, which was larger than they had anticipated, and employed the use of a Gore-Tex patch. The infant's operation was further complicated when it came to her transposition of the great arteries. She has been diagnosed with asymmetrical anatomy, a rare condition where her pulmonary artery is larger than her aorta. In a healthy newborn, the pulmonary artery and aorta should be the same size. The surgery now complete, baby is now safe in the ICU with her parents, who can finally breathe a heavy sigh of relief now that the operation is over. They pray the nightmare is over, but they have to wonder, is this only the beginning of more to come?